Epilepsy is a disorder in which the brain receives surges in electrical signals which results in seizures. There are a number of causes of why seizures happen. It can be from genetics to a birth injury to developmental disorders such as a brain damage to the fetus, brain trauma from a car accident, sports injuries, drug and alcohol abuse, infections such as meningitis or a brain tumor. However, in many cases, the causes of seizures are unknown. Epilepsy is a condition that is defined by multiple seizures. Epilepsy is a seizure disorder, not a psychological disorder or a disease, and it is not contagious. In the general population, about 1 in every 100 people suffers from epilepsy. People of all ages can have epilepsy. There are 2 types of seizures. There is partial and generalized. If the sudden excess electrical activity occurs in one part of the brain, then it is called a partial seizure. When it affects the whole brain, then it is called a generalized seizure. You cannot stop a seizure from occurring. Most seizures will last for seconds or even several minutes. Symptoms of seizures include temporary confusion, staring, loss of memory, appearing not to be paying attention, blank look, loss of consciousness, and uncontrolled jerking movement. Having a student with epilepsy in your class, you would need to educate yourself on the particular types of seizures they have so you can be prepared to help them during a seizure and to keep them safe, as well as knowing what modifications you can make in your class to help them be successful. A student with epilepsy could have an SAE project. A modification to that could be to assign a buddy, such as another student who understands their condition and would help them through a seizure if they should have one while caring for their SAE. Students with epilepsy could have any SAE as long as they had someone who would go with them at all times to make sure that they were safe if they were to have a seizure or to call for help if needed. They could do any work experience SAE, any animal project SAE, or plant project. I don't see any limitations other than their safety. As far as FFA, they could do leadership conferences, team building events, job interview contests, and impromptu speaking, just to name a few. I believe these students would be very successful in these activities. You would just want to have a plan in place in advance on how to handle if they were to have a seizure at one of these events. And they should never be left alone. They should always have somebody with them who knows their condition and how to help them through that condition. And so having a buddy or another teacher or a parent go with them would be beneficial and necessary to make sure for the safety of these students.